Hey guys, gonna quickly go through these. So I'm looking at first the hip practice questions. So question number one, prone position on the table. Which of the following tests could the PTA perform this position? Uh, Hip flexion range of motion in prone, no. Hip extension range of motion in prone, yes. Hip flexion MMT in prone, no. Hip abduction MMT, no. Um, I guess that's an imperfect question because hip abduction and gravity min you could do, but I was leaning towards hip extension range of motion for that to be the correct answer. Um, Capsular pattern, just got to look up what capsular pattern is off the top of my head. I can't remember if it's flexion first or internal rotation, so look that up. It's either A or B on that one. Next one, based upon the above data, what should the PTA focus their treatment on? I'm going to cross off the strengthening first because there's no MMT data for that. So we're going to do its range of motion something. Then I just have to choose hip IR versus range of motion or hip flexion range of motion. It's whatever one is the most impaired. Um, Imperfect numbers, I don't love where I put this here. I think I was hoping you were going to pick flexion there, but I don't love the numbers. It's not as precise as I'd like to be for that. But if your thinking is correct, then then you'll get the right answer on the test that is written a little bit better. PTA had Mr. Fitzgerald in a supine position. He could actively move 35 degrees in hip abduction. What would the MMT grade be? All right, so if we go back to the chart, hip abduction, he either had, now, flaw of the question that I put, we got to know which hip we're talking about, but it's either going to be 35 out of 40 degrees or 35 out of 50 degrees. Either way, that's greater than half, but less than full in the gravity min position. So that answer is going to be a 2 minus. All right, going to the ankle, knee and ankle. PTA performs an MMT on the patient and side lying is able to extend their leg from fully flexed to 80 degrees. PTA should do next. All right, well, we don't need to move to the seated position and continue the test. We cannot perform what we need to, right? I'm describing that we're in gravity min for knee extension. So can't be A. We're not going to move to supine. Can't be B. Now we just have to choose, is it a 2 minus out of 5 or a 2 plus out of 5? Well, 2 plus out of 5 is against gravity, so it's got to be 2 minus. Next question. Patient going to perform 10 degrees of right angle eversion in side lying. What would their MMT be? All right, so the answer is 2 out of 5. Full range of motion in gravity min position for this. So that's B. MMT testing, they were able to form dorsiflexion in the seated position, but only while extending their big toe. What are they likely substituting with? Well, it's not post tib, right? That's a plantar flexor and inverter. Anterior tib, well, that's the muscle we're testing, right? But they're substituting with something. We can't substitute with the muscle we're trying to use. So those two are out. Then it's flexor or extensor hallucis. All right, well, we just said we're extending, so the answer's got to be A. Performing lateral toe MTP flexion, muscle should be palpated as it's performed. The answer here is lumbricals. There's going to be a few questions on the test about toe stuff. If you know the rest of it, you're going to be fine. I think they're going to be annoying, but fair enough. So I hope this helped you. Good luck on the rest of your studies. Get a good night's sleep, okay? See ya.